Hi, this is Dr. Priscilla Silveraj, professor in the psychology program at Hardin Simmons University. So this is a lecture on mental health issues or psychological disorders. And we're just going to go over an introductory part one. So we see that mental health disorders or psychological illnesses affect 1 in 4 people. So if you look around in a family, you can make that count, and probably you've guessed it right. 1 among you have either a diagnosed or an undiagnosed mental health issue within just a unit of 4, a family unit of 4. So mental health issues is much common than what we actually think about. Around 450 million people around the world of all ages suffer from some kind of mental health condition. And it is, according to WHO, one of the leading causes of disability and ill health globally. And it does give her a lot of perspective. To some of us, it might be hard to think of it in terms of internationally. Let's see in the U.S. 18% of adults have mental health condition of some kind of mental health condition in the U.S. alone. This accounts for about 44% of 44 million Americans in the U.S. Just this is from the latest census that we got for understanding the mental health issues through NIMH, I think. So, sometimes I tell my students it's hard to think of this 44 million and kind of wrap your brain around how much it is. If we try to make it more into digestible palettes, like this, 1 in 6 U.S. adults actually live with mental illness. So that gives us a perspective, right? So in 6 of us, 1 among just 6. So a group of friends, when you hang around, think of how much true it is. About 56% of them, though, do not receive medical attention or the treatment that's required for that. So this, if we don't understand how much 56% is, think of this way. 1 of 5 of us actually have some need that's unmet. How alarming, but sometimes I'm sure some students have told me it's not really surprising, but because it does make sense that people do not talk about it. There's a lot to do with stigma and a lot of factors that do contribute to this. So yes, we're going to talk about psychological disorders, for which it's important for us to first understand the psychological disorders' underlying principles and what has actually rendered in terms of history to where we are today. I'm going to show you this picture and ask you, what do you think is happening in this picture? Is this something normal? Or would you consider this to be an abnormal image? Right? Most of you would say probably abnormal because it does look, some students have used the word crazy, creepy, scary, insane. So yeah, a lot of us can probably attribute it to one of those. What do you think of this though? Well, I can hear some laughter. I can hear, yeah, it does make sense, right? I mean, I can hear people kind of have an idea what I'm talking about in terms of how common it's become on a game night for us to wear this kind of face paint or tattooing all over our body, and it is okay. It doesn't seem like this person is crazy. We won't use the word insane looking at a person like this on a game night, do we? But what if this person, according to someone in the other part of the world, probably from where this person is, you would see this and think, okay, this is not normal, right? So how do we define what is normal and which is not? So we need to have a clear identification system to explain which is a normal behavior and which is not. Abnormal behavior is considered as a pattern that we can find in the way people behave or the thoughts or the emotions that is considered to be meeting 4 of these criteria. which is deviance, dysfunction, distress, and danger. Deviance is when that is away from what is norm, when the issue actually, when the condition impacts a person's life beyond just a psychological factor. If because of the disorder, if an individual is not able to maintain close relationships, or is not able to be in a job, in a stable job, or is making poor financial decisions. So those are some of the things, some of the factors that you can think of in terms of dysfunctions that we consider as a criteria that that behavior or the condition may be something abnormal. And if that causes quite a amount of distress, then we would say, yeah, that behavior is abnormal. And if that is a danger to self or others, we would say it's an abnormal behavior. So yes, these factors are important to consider. But let's go back a little into the history and see when in Stone Age, demon possession was something that was attributed to people who behaved differently from the norm, right? Who exhibited deviant behavior. So people believed if you drill a hole in their skull, through their skull, which is called trephination, their evil spirit would be released off, which sounds very torturous, but this is a practice that was done for a long period of time. But eventually, there's what's called exorcism. A lot of you would have seen a movie on this. So exorcism was a practice that came about after that. If you click on this should take you to this YouTube link that actually opens to a modern day exorcism practice in the Catholic Church community. And it's interesting for us to get a perspective on that. And then it moved to more supernatural witchcraft and torturing, imprisoning people, and so on. Asylums came to being in London. It was, people started going to zoo where you could pay a penny instead of animals. You could, in addition to animals, actually, you could also look at human who were caged for people to come and look at, who were conditioned mentally unfit. So that were kind of the inhuman nature in which people were treated. Then came what's called medical model and psychiatry, the field of study where focus was more in terms of mental illness being a disease and then which needed a treatment, a cure, and diagnosis, and so on. So we can see that we did come a long way. Where are we now? We are in a modern field of study of psychology where psychological disorders are no more seen in that light. We see it more in terms of a holistic perspective that includes biological, the cognitive, the psychodynamic, and socio-cultural. So if a person exhibits a behavior, we are not just going to think of from one perspective. We're going to look at, is it something that they've learned in with regard to their cognitive learning that's a result of a faulty learning or a cognitive distortion? Or is it something that's to do with their brain? Or is it the family conflict or the cultural values? And is it something because they didn't have a role model, they didn't have a father figure growing up? Or was it because of something in the childhood that actually causes them to behave a certain way? So we do consider a lot of factors before we do make that particular decision of the mental illness. We use what's called DSM. DSM is a classification manual that's, in some people even go as far as calling it the Bible of psychology, because we do have all the topics lined up and coded and grouped together to make a meaningful classification system all across the world so people can use the same way in interpreting people's behavior. Now what we have is called DSM-5, which was revised in 2013. But here what we do actually is we do have a set of criteria, and we assess people through clinical interviews and assessment tools and see how they score on those, and based on the criteria, if they meet 3 out of 5 or 5 out of 6, and based on the criteria, we do come up with, okay, how severe is the disorder and do they qualify for this particular diagnosis, and then we tend to give them a label. This is depression, or this is a bipolar disorder, or you have obsessive compulsive disorder. We do give them a label. What do you guys think about label? In your comments below, write what do you think about those? Do you think it is helpful, or do you think labels are pretty harmful? There are arguments both sides, but let me first just point out that there are people who do consider that labels are not good because it encourages people to kind of hide behind their diagnosis. A lot of us may not agree with that, but I just wanted to point out that labeling people has been considered both something positive and something that's not really helping. Think of this. This is what is happening when you think of shootings that are taking place, that we hear about every day. Media covers the shootings, and now that we think about it, and all the shooters somehow, majority of them have some kind of mental illness. And when media does report on that, do you think that increases people's awareness, just the awareness, or it also creates a negative attitude for people towards the shooters? Well, it was found that despite the fact that most people with mental illness are not violent, actually people created and started having a negative attitude towards people with mental illness because they were considered someone who could be of a potential harm to their safety. So this is sad, but that's one of the studies that I've just came across recently, and I thought it was interesting to point out. Leave your comments below. Let's talk, engage in a conversation on that, and then the videos following this, on the part 2, we'll talk about anxiety, and part 3 on depression, and the part 4 on suicide.